So ventricular tachycardia is an abnormal heart rhythm that starts from one of the bottom chambers of the heart called the ventricle. It can happen either in the right ventricle or the left ventricle. And this happens mostly in patients who have had prior cardiac problems such as an old heart attack, some other cause of heart failure. So ventricular tachycardia specifically is kind of a malignant rhythm problem because it can make people pass out, and it's also a very important cause of sudden cardiac death. When we see patients who have ventricular tachycardia, patients usually present to us because they have palpitations, they feel fluttering in their chest, they have dizziness, some people just truly pass out, or some people have a cardiac arrest that they need to be resuscitated from. And that's when we get involved in their care. So when we see these patients, primary goal for us is to prevent this from happening again in the future and make sure they are protected if this were to happen. One of the most common procedures we do is implantation of a defibrillator, which can detect these ventricular tachycardia problems and treat the patients appropriately. But that doesn't solve the whole situation because the defibrillator is more like putting a Band-Aid. So patients have this problem, the defibrillator treats it, but then they can have it again. So we offer a host of other treatments to prevent VT from happening again and again. That could be medications or invasive procedures such as ablation. Unfortunately, medication options for these conditions are often limited because of multiple other factors. So catheter-based ablation is something that we do that really changes outcomes in these patients. For these procedures, we actually create a really high-density electrical map of the heart to find out where the scar tissue actually is located. Then we try to put these patients into ventricular tachycardia and see where it's coming from. And once we pinpoint it using our GPS technologies that we have, we put our ablation catheters in there and try to kill off all these abnormal cells that are causing these rhythm problems. And multiple studies have shown that the earlier we do these procedures, the better the long-term care and outlook for these patients are.